What do you think is one of the most common knee injuries in athletes? If you thought it was an ACL tear, you're wrong. It's actually a meniscus tear, which is kind of ironic because most people don't even know what a meniscus is. So what is a meniscus? A meniscus is a crescent-shaped, rubbery-type cartilage in the knee. There are actually two of them. You have the medial meniscus, which is on the inside of the knee, and the lateral meniscus, which is on the outside of the knee. It provides a vital part in the knee joint because it's a buffer between the femur bone and the thigh bone, or the femur bone, which is the thigh bone, and the tibia, which is the largest bone in your leg. So today we'll be learning just how this vital part of the knee can keep an athlete on the bench, the types of treatment they might have to undergo, and just how they will be able to recover in time for their next season. For starters, you're probably wondering just how can an injury like this happen? Well, it's quite simple. According to orthoinfo.org, the most common way that an athlete can tear their meniscus is when they are in a squatting position and they make a quick twisting motion. Other ways that it can happen is through direct contact, such as a tackle or collision. It also can be torn through the acceleration and braking when running. For non-athletes, a meniscus won't typically cause issues unless you're older and have aged tissue. Then the meniscus can easily tear with any type of movement. It's common for an athlete to play on a torn meniscus, but will have setbacks due to the pain. Some other symptoms besides pain are stiffness, which is in most part due to the swelling that will occur, the sensation that your knee is going to give out, the lack of range of motion, which is also due to the swelling, and the locking of the knee, which doesn't typically happen unless the part of the meniscus that was torn gets flipped into the joint. Now that we've learned just how an injury like this can occur, you're probably wondering what type of treatments there are and how it gets its diagnosis. According to the Mayo Clinic, a meniscus tear can be diagnosed through a physical exam, which is just the bending and twisting of the knee, which can be very painful. After an exam comes an x-ray. The x-ray can't specifically show a tear in the meniscus, but it can rule out any other problems within the knee. After an x-ray will come an MRI, and this is what will officially diagnose if there is a tear. If there is a tear, there are many different types of treatment that can be done. For the least severe tear, a doctor might prescribe what is known as RICE, rest, ice, compression, and elevation. But surgery is needed in most cases. The two different types of surgeries that there are is a meniscectomy, which is where the doctor will go in and they will cut out the part of the meniscus that was torn. And the other one is a meniscus repair, where they will go in and they will stitch up the part of the meniscus that was torn. The most nerve-wracking part about surgery is that you won't know which surgery they're performing beforehand, which means you don't know how long your recovery time is, and it can range anywhere from weeks to even a whole year. Speaking of recovery, you're probably wondering what these athletes will have to do to get back in time for their next season. According to the Cleveland Clinic, the patient will have to stay in the post-op area for approximately 3 hours, and then will be tested out on crutches, and then the knee will most likely be bandaged and wrapped in a compression dressing to ensure that the swelling is kept under control. Pain meds will be provided, but won't always need to be used. Crutches are typically used for 2 to 3 days for a meniscectomy, and by 1 week, the patient should be able to walk at 100%. For a meniscus repair, crutches are typically used for 6 weeks, and a brace will also be needed to ensure that there is no weight bearing on the knee. Typically, 2 to 3 days after surgery comes physical therapy, and that's normally in 3 different phases. The first phase is used to focus on regaining control of the muscles in the leg, such as the quad, and it's also used to make sure to wean the patient off of crutches. The second phase is focusing on the range of motion to make sure the athlete can make their knee go all the way straight and make sure they can bend it all the way. The last phase is to strengthen both the operative and non-operative legs, which also can help prevent the injury from happening again. Overall, recovery time can range for a meniscus repair can range anywhere from 6 to 8 months, and for a meniscectomy, it can be anywhere between 6 weeks and 3 months. In conclusion, let's look back on all that we have learned today. You have learned the causes, the symptoms, the treatment, and the recovery that an athlete will have to undergo if they have torn their meniscus. This process may seem daunting, and it is, especially for an athlete who's nonstop. But I've experienced this twice in the last 2 years and can say that it's good and it's worth it to be able to go back out and play at your best once again.